Welcome to Life Science Success Podcast. My name is Don, and I'm the host of the podcast. And today I'm actually broadcasting live from from the Bayou. So I'm very excited to be here with Lowry Curley. Welcome, Lowry.
Hi, Don. How are you?
Can you tell the listeners just a little bit about yourself and what brought you into life sciences?
Yeah, absolutely. So my name's Lowry Curley, the CEO of AxoSim. We'll talk about my company a little bit later on. What brought me into life sciences in general is I actually had a neurological condition when I was an undergraduate, and it drove me many twists and turns along the way, but into biomedical engineering
Uh-huh.
and specifically tissue engineering. And the technology I worked on during my PhD at Tulane University ended up spinning out AxoSim in based on that, licensed that technology and did that in 2014 and have been growing ever since. So
Well, it's not very often that I hear that story, right? So a lot of times I hear, well, I mean, I guess I do. I am aware of other situations where people have, kind of been, followed the complete journey, but it's not that often that you kind of hear somebody started with the problem, they sort of built it into their research, and then in the back end, it winds up, spinning out as a company. So that's pretty amazing.
it's always funny looking back on the circuitous route, right?
Right? Yeah, exactly. So why don't you tell us a little bit about Axosim?
Yeah, absolutely. AxoSim's mission is to empower advancements in human neuroscience. So, you can guess from my path that neuroscience is always something I've been very passionate about. We are a provider of 3D tissue engineered models, drug discovery platforms to help pharmaceutical scientists kind of accelerate and make more effective treatments for neurological disorders. Everything from, Alzheimer's, multiple sclerosis, neuropathy, ALS. We're really aiming to address all of these diseases that are unfortunately debilitating and do not have cures yet. But we have a tool that can really change the story there.
And how does somebody see the 3D model? Is it strictly on a computer, or can you see it in VR as
Oh
well?
no, this is a stem cell based model. So these are living human cells that we organize into an environment. So it looks just like the human nervous system. And we are then able to introduce drugs to see how that might change it, whether it's healthy cells and maybe those drugs make them less healthy, or it could be from a patient who has something like ALS. And we can add a potential drug that a pharmaceutical company might be working in, long before they go into humans, but let them test them in human cells, before animal testing, which has unfortunately proven to be ineffective.
Yeah. Yeah, so, and then in terms of the companies that you typically interact with, what do they look like? Are they very early stage or mid or
No, no,
larger?
big global
Yeah.
pharmaceutical companies.
Okay.
Yeah, so we work with one of the top three biggest in the entire world. They're based over in Switzerland. And we've more recently actually started working with some earlier stage companies, which I think is a really good sign of our technology adoption, but then really the 3D model space in general, because big pharma has more resources, right? They've been working with these for years. I mentioned we founded in 2014, first commercial work in 2017. And now that big pharma has kind of proven it out, the earlier stage biotechs who may not inherently have as many resources, but need an edge even more so are coming in, and it's fun working with them, because a little bit of a different interaction, a little bit more maybe intimate, work within their workflow. So it's fun. It's man the gamut.
So you've definitely spanned the gamut as well in terms of working through COVID and things like that. I mean, was your team entirely remote through COVID, or how did things play out, there?
Oh yeah, good question.
Yeah.
Hopefully I don't get PTSD reflecting on it.
Reflecting? Yeah.
No, so, as I mentioned, these are stem cell based models. So we have multiple laboratories in the New Orleans Bioinnovation Center, just right upstairs, literally. And so we have to come in, at least every other day to feed these, to make sure they're healthy, and then ultimately test them. So we had to shut down the lab for a period of weeks, when things were really bad. Team safety is of the utmost importance to me. We're nothing
Sure.
without,
Yeah,
without
for
our
sure.
team, right?
Right.
And then once we kind of figured out how to come back, originally kind of in a shift type of work. And then ultimately, as we got back to it, we figured out ways to be safe and we had so much work to do. Pretty much everybody came back. Of course, we had a few who stayed remote for a little while, but I think everybody was excited to get back to some semblance of normalcy.
Well, especially if you work in a lab. I mean, it's there's so many people that are so passionate about the work that they do and like digging in and really wanting to, spend time doing the thing that they were meant to do. And so being remote, probably would be much more of a challenge.
Yeah.
Somebody like me, most of my work went remote, and for the most part, has stayed remote. So I'm not.
The scientists and research assistants and associates we have love what they do. So yes,
Yeah.
they wanted to get back to it, right? Get back to these exciting models and really, continuing our mission.
Very good. And then in terms of your interaction here with Bio from the Bayou, so what brought you here, and what are you hoping to gain out of the sessions here?
Yeah, I'm really excited. There are a number of pharmaceutical companies that have come. This event has really expanded to encompass a lot more of, the region and the Southeast. And so there's both, some later stage academic research I'm excited to see. You never know when we might find a new technology to license and learn from them. And then, as I mentioned, a lot of big pharma companies here and investors. So I want to connect with everyone and both let them know all the exciting stuff we have here, but then also, develop and leverage those relationships.
Yeah, it definitely is an exciting event, and it's interesting to see these kinds of things starting to crop up in different geographies as well. I mean, and all the activities that are going on at Tulane are amazing. I mean, it's just I know there are other people I've interviewed from here, like Trivia Frazier. I've interviewed her before on the podcast as well, and she's actually going to come back, I believe, later this afternoon. So yeah, it should be another guest.
Trivia is doing some amazing work.
Yeah. So, well, Lowry Curley, thank you so much for being on the podcast.